but we're now going to have a look at the different issues that have been raised in general over the past few weeks as South Africa has moved from level 5 down to level 2, and the number of cases have also been, the number of new cases have begun to decline. And it seems that as a country with our response, we have begun to move in the right direction. So we've got some questions around this. Usaamah is going to start us off with question number 5 relating to this.
Hi, Professor. We are number 5 in the world in terms of cases, and people are worried that the number of cases might increase, and there are not enough testing being done. Why have we got into level 2?
So that's a very great question. So I think at the beginning of the epidemic, there was a global shortage, a worldwide shortage of tests. And so all the countries were competing to try and get the materials to test. And when we went to level 5 lockdown, that meant that we also closed down our international airports, which impacted on our ability to bring the tests in. So during lockdown, we slowly increased our ability to test. And in South Africa, we now have the largest testing program in Africa, but still that is not enough. So we need to continue to test. It's very hard to use tests as an indication of how bad or how good your epidemic is. So testing just gives us a small flavor of the epidemic in our country, and we have to use other ways of trying to understand how our epidemic is unfolding. We can do tests where we can test members of the community called seroprevalence surveys, where we can look for presence of antibodies to see if you've been exposed before. So that's one way of looking at how the epidemic has progressed. Looking at how many people get admitted to hospital, looking at how many people die are an important indicator of the epidemic. And so South Africa did have a rapid increase in infections. And we remember, I think all of us remember, in June and July, how horrible it was when all the hospitals were full and we were hearing that we were running out of oxygen. But luckily at this moment in time, we've over the peak, and we now are what I would call an endemic phase of the epidemic. And this is where the community transmission continues, and we continue to have, we can't eradicate the virus, but we continue to have onward infections. And how bad the epidemic gets now after our peak depends upon us. So if we continue to have to use masks, wash our hands, and keep our distance from people, if we continue to have well-ventilated areas, if we continue to avoid congestion and crowds, we can prevent another surge, and we can prevent our epidemic getting out of control in South Africa.
Professor, I also have another follow-up question. What influences does the numbers have on justifying us moving into level 2? Are there any other things that you have taken into account?
So we have to take a lot of things into account. So besides the testing, we also have to think of other ways of testing. So at this moment in time, because we had a shortage of tests and because we had a surge, we could only test healthcare workers and people who were symptomatic, who were in hospital. So we had to save our tests for them. And the other ways we can manage the epidemic is to look at other ways of seeing where the epidemic is going. And so there is research being done on whether we can use wastewater or sewage systems to look for the presence of virus in there to predict new outbreaks. We also now in South Africa have to move to a different testing strategy where we can make sure we start to test more members of the community, maybe test children at school, test teachers and other people to see how the epidemic is evolving in those areas of society.